Ear concerns and complaints can be common in children and adults. Dr. Lindsey Fish, medical director at Denver Health Peña Urgent Care Clinic, is with us today to talk a little bit more about this. Thank you so much for being with us.
My pleasure.
We always look forward to having you with us on Thursdays.
Thank you.
Let's talk first about some of the different problems that pop up with ears.
So patients come in complaining of lots of different things. Ear pain is very common, but here in Colorado we also get lots of complaints of ear fullness, decreased hearing or hearing loss. Even things like fever and dizziness can be related to ear concerns. We diagnose commonly inner ear infection or an outer ear infection like swimmer's ear, and we diagnose different causes of dizziness from things inside the ear. So really a wide spectrum of things that we can see coming from ears.
How do you figure out what's going on with the ear? It seems so complex.
Yeah, so it can be hard. First, we start with asking questions. Your physician or your provider is going to ask you different questions about what you're experiencing and what that's like. Most people are familiar with the common otoscope. That's when we look in the ear to sort of see what we can see in the ear. And then lastly, there's some additional diagnostic tests that we can use, and one that we're using in our urgent care is called the tympanometer.
Let's talk about what that is. Explain. I've never even heard that word before. So what is it?
Right. So it is an instrument that's been used regularly for quite a while by ear, nose, and throat doctors or audiologists. So the specialists have used it. And it's a tool that goes in your ear, just sits there for just a brief period of time, like when you get your temperature checked in your ear, and tells us more about the eardrum. Is there a hole in the eardrum? Is there fluid behind the eardrum? Is it moving the way it's supposed to be moving? Things that are sort of beyond what we can always see when we look.
Oh, fascinating. Let's talk a little bit about a study that you are taking part in.
Yeah, so Denver Health Peña Urgent Care, in conjunction with Compasio Medical Education, is excited to pilot the use of the tympanometer in the urgent care setting to really help us get better at diagnosing ear complaints and improve our treatment for those complaints. And we're one of the first, if not the only, urgent care in the country using this.
That's fantastic. Well, thank you so much for being with us. We appreciate it. And always educating us on Thursdays. Dr. Fish, thank you so much.
My pleasure. Have a great one.